Welcome back. Dr. Todd Smith, internal medicine physician in Princeton, West Virginia. And I am delighted that you are back and listening to my videos on possible solutions to help this healthcare system. My goal behind all of this is to restore healthcare in America, and we can do this. But we might need to think out of the box a little bit. And that is where my videos, I hope, will help. Today's video is going to be about personal affordability. Now, before we get started, I think that we need to understand this video is going to be geared towards the patients, and I hope that there's going to be a small portion of this that the providers out there will find of use also. Because honestly, as providers, we are also patients. We do need that health care. So let me also tell you that this video is going to be for the people who are actually employed in America. And so there are the people that are working, there are the people who are not able to work, and I'm going to address that in other videos. So, first of all, let's talk about the problems. And so, as a physician, I get to hear constantly about how patients cannot afford their health care. They cannot afford health insurance. And the health insurance that they can afford, well, it really limits the amount of coverage that they have. How many times, as me being a physician, have I had a person that has hypertension, and we have tried a multitude of medications to get the blood pressures fixed, and finally we're able to find that medication that works, and the insurance company says, well, that's not on our formulary. They're going to have to pay a lot for that. And the patient feels that they are putting a lot of money out every year for insurance and that they deserve to have that because that's the medicine that's working. That is only one very small example of the big problem that we're seeing right now. Let me give you another problem. I did some research, and 2018 data, the single person who is actually buying health care and buying health insurance, that person is spending anywhere between $7,000 and $12,000 a year on premiums and possible increased costs that they have to put out for their health care. That is a single person every year, if they are even paying for health care. A 3-family household is paying anywhere from $18,000 to $27,000 every year for the same. Now, what happens to that money if it's not used? We want them to be healthy and not have to be able to have any need for the use of this money. But what happens with that money? And is that money better in your pocket rather than going to an insurance company that is going to control costs and maybe tell you this is the medications that we're going to allow you to have. These are the tests we are going to allow you to have. Does any of this make sense? There's a huge disconnect. And that is what I'm trying to fix. That is what with this that I am determined that we can make a difference. But again, we need to think outside of the box. And in that box, I want to make the providers and the patient the center of care, not the third-party payers. Let me also say that health insurance probably should not exist, and that is a big problem. I'm not going to be negative to the insurance companies. Actually, right now, they're what's trying to hold all of this together. And the problem, though, is that health insurance is really not health insurance. Now, let me explain that one to you. Insurance. Let's talk about car insurance. Car insurance. You have an 18-year-old male, an 18-year-old female, and the 18-year-old male is going to have a higher insurance cost per year than the 18-year-old female. Why? Because the statistics have shown that an 18-year-old male drives a little bit more recklessly in general. Maybe they will speed a little bit more in general. And they have a higher incidence of needing to use insurance. So they're going to pay a little bit more. Home insurance. If you have a home that is in an area of the country that has a high likelihood that you are going to have a catastrophic event, natural. If you happen to be someone who has had 4 house fires, you're going to pay more insurance with those scenarios than someone who has never had one claim for home insurance. So that's insurance. Now let's go with health insurance. I personally believe that pre-existing illnesses should not be a part of this equation. It's one of the things that I did like about the Affordable Care Act. However, guess what? That right there just says that insurance should not exist. Because health insurance is saying that if you have a pre-existing illness, your likelihood of needing to use the funds in insurance is going to be higher. Does that make sense? Okay. And before we go any further, I'm going to already negate what the critics are going to say. Because there are people out there who says healthcare is a right. Healthcare is a God-given right that every person in America deserves equal, we'll discuss that in a later video, and affordable healthcare. Now that is a debate that we can discuss for a long time. I personally understand that, but I'm not talking about that. I'm talking about health insurance, not health care. There's a difference. Health insurance should not exist. Because what you're going to get with that is you're going to get a company that is trying their best to be profitable so that they can stay in business. And with that, that's going to have some limitations on care, limitations on medicines, limitations on what they'll allow you to do. Okay, so let's try to look at some solutions. Now, remember that single person household, $7,000 to $12,000 every year, and if they're healthy, it's gone. Let's look at the 3-family household. They are anywhere between $18,000 and $27,000 a year, and if they are healthy, it's gone. So why don't we try to think about this a little bit differently? Let's look at changing our philosophy. And our philosophy needs to be, let's keep our money. And at the same time that we're going to keep our money, let's be a little bit more responsible with that money. Let's control costs together. So, solution. Those people that have that money that they are putting away in health insurance every year, what we are wanting to do is we're wanting to take the household income, the gross income that a household brings in every year, and we're going to say that that income is going to be our standards for catastrophic health insurance. Because catastrophic health insurance is going to be different per your income. A person that makes $50,000 a year is going to have a higher financial burden at a lower rate than someone who makes $1 million or $2 million a year. So if we take the gross income of that household, then we say with that gross income, X percentage, 5%, 10%, 20%, 25%, 30%. That's something for us to debate. But if we take that percentage and say anything above that is going to be catastrophic insurance, and that is where insurance company with some government funding, government funded, whatever we want to do, anything above that is going to be considered catastrophic for that individual and that family. So we are covered. Anything below that, the patient is going to be responsible for paying. How are they going to pay that? Well, remember that money that we are just throwing away to the companies? The money that is better in your pocket? Aha. Now we're going to have a little bit of skin in the game, because what we are going to do is we're going to take that money and we're going to put that money in a robust health savings account. Not like the health savings accounts we have now. A robust health savings account. A little bit like our 401k. Something that will be matched by the employers. Something that will be placed into an account that can accrue interest. So for the people who are single employed, people who are self-employed, those people are going to be able to put this money into a very, very, very robust health savings account that can accrue interest. And this money is going to be rolled over every year. So think about that. You got the 7,000 to 12,000 single person. That $7,000 over 10 years. And if we accrue interest in that, and if we roll this over every year, now we've got something. If you need that medicine, you can buy it. If you need to have that scan, you can buy it. And you're going to say, but the scans and some of these medicines are astronomical. Another video, we'll talk about that. So now what we're going to have are people that are going to say, well, how about insurance? We're still paying for insurance. That insurance should be cheaper. Should be cheaper. And the reason why is because we're really not going to be dealing with pre-existing illnesses at this point. It's going to be income-based. But now we have insurance. health insurance. It is going to cover those areas that are above a certain cost. Health insurances can be very much a part of this, but we have got to make a change. So, I want to thank you. I want to encourage you to think about this with people. I do not mind criticism on the page, but at the same time, I do mind people that critique and say that this can't be done, but they have no valid options or solutions. They're just criticizing. That doesn't help anything. However, if you have some constructive criticism that you say, I don't like that, but sort of like where you're going with this, but what if we do it this way? I'm open for it. Let's fix this. We can do this. Thank you for listening to my video on patient affordability. I want to continue to invite you on our long journey to restore healthcare in America. We can do this. Thank you.